Welcome to Season 2 of the Empower to Heal podcast. I'm your host, Dina Tipsherini, and I'm so excited to take you on a journey through the ups and downs of motherhood. Together, we are going to learn, prepare for, and unearth all things motherhood, because I believe that exposure and awareness can lead to empowerment. So buckle up for an unfiltered, raw, and insightful journey. Hello, and welcome back to the Empower to Heal podcast. I am so excited that you're here today. Today, we have a special guest interview, and this is somebody that I recently met through a call. They reached out to me in an email to share about their services and invite me to be a part of their directory. And when I learned of this service, I realized how powerful it can be for so many families out there. So let me introduce you to Jana Pitcock. She's the lead dietitian of MyOr, a company dedicated to helping parents identify food allergies in their children early in life. Jana is a mom of two with her own food allergies, and she's a registered dietitian who has worked with clients of all ages for over 17 years. Jana was intrigued to work with MyOr because of her struggles with food allergies and the opportunity to help parents early in their child's life. So, the mission of MyOr is to lead a healthcare revolution by transitioning from a reactive to a proactive healthcare, significantly reducing the occurrence of disease development related to allergies. They predict diseases using advanced AI technologies to effectively bridge the gap between prediction and disease onset, and they employ precise nutritional interventions to optimize health outcomes, empowering individuals to proactively take charge of their well being and lead healthier lives. Jana, thank you so much for joining us today to spread this knowledge.
Absolutely. Thank you for having me.
Yes, of course. So, when we spoke earlier, I had no idea something like this existed. I didn't know that you could predict somebody's allergies and that there was like an algorithm to do so.
Yeah, I had no idea either. It was new to me. I joined MyOr a year ago, a little over a year ago, and I couldn't believe whenever I read on LinkedIn what it was about. And as I delved into the science and everything behind it, to be able to be, proactive and have this information during pregnancy before the infant's even born is so life-changing and amazing, and be able to focus on prevention instead of managing diseases. That's really like every dietitian's dream. And as a
Mhm.
parent, we want to be able to have control over those things, and knowledge is power. And this gives us the knowledge to make the changes and implement the necessary things to be able to prevent these um, food allergies and eczema in our little ones, which is super exciting.
It's amazing. So I'm just going to like capitalize some of the things you just said that I would love to talk about today. One is you can do this while the baby is still in the mama's womb. We
Yep.
can do this during pregnancy. And the other is we can use the information along with like valid, proven methods to prevent the allergy from happening.
Yes,
Oh
yes.
my God. Like
So
that sounds too good to be true. Can you
it
teach us your
does.
ways?
It does sound too good to be true, and it comes down to the skin microbiome and the gut microbiome. And so during pregnancy, mom or dad can take a survey. It's a 3-minute survey. It's on our website, and it answers questions about, genetics, if mom or dad has certain backgrounds, food allergies, eczema, asthma, rhinitis. It looks at if there's any siblings, if they had it. It will look at if baby's already born, it'll see what gestation, so if they're premature, that can factor into it. And then, vaginal or C-section, those can play into it. So it's most accurate shortly after birth because of those two specific questions. But with all the other questions, it is still very accurate during pregnancy. And really, it's as simple as taking care of protecting the skin biome and then microbiome, and then knowing when and how to introduce those allergens with when the initiation of solids. So it's a lot different than, whenever I was having babies 12 years ago. Science is ever changing. And I was actually, told and instructed not to introduce allergens for several years. And
Mhm.
especially being someone that has a food allergy. I was terrified to, expose my kids to food allergens. And so now the science has shifted and shown that it's actually better to introduce those. And so we work very closely because that can be very anxiety provoking, especially if there's someone in the house that already has a food allergy. And so we work very closely with them as dietitians and help guide them and the family of what that looks like for them and their family. So it is definitely super exciting, but it can be scary for some families as well. So we want to hold their hands and talk them through it and have more than, a 15-minute conversation in the pediatrician's office. And that's really, we're there to help bridge that. So that's our main goal and our main focus.
Are you on the brink of parenthood, eagerly anticipating the arrival of your little one? Take a proactive step towards preparing for the whirlwind journey ahead by joining our waitlist for the Empowered First Year Postpartum Prep course. Designed with your needs in mind, this online 4-week program offers a comprehensive blend of education, skill building, and community support to guide you through the demanding postpartum season. Don't navigate this transformative time alone. Click the link in the show notes below to join our next cohort and embark on your journey to parenthood with confidence. Wow. So I think there's like bits of wisdom you can drop here without giving like medical advice because clearly you can't give like everybody
Right.
very generalized advice, but
Right.
I hear you saying like there's tidbits of things that we can be aware of when we're
Hmm.
pregnant or right after we've given birth to support our child in having a better health outcome. And
Hmm.
so, what are some of those key things that you recognize? You mentioned something about the skin microbiome. You mentioned
Hmm.
like introducing allergens a little earlier, but what is some information you can share to empower our listeners today around like, wow, let me get curious about this. What would this look like
Hmm.
in my life?
Yeah. So I mean, are you talking like specifically about those things, like what we can do? Yeah. So,
Yeah.
so the products that we're putting on our babies, from birth, ideally from birth, to be able to protect their skin, and not wanting there to be any allergens of any kind in those products, even fragrances, things like that. And there's some
Mm.
big brands out there that you might be surprised by that will have some of those things in them. So really, just
Mm.
looking at all of that, but making sure that we're putting the lotions and the creams on our babies every day and keeping that skin protected. And little things, it's, a little bit of dirt is good, right? So we don't want completely sterile environments. It's good for, babies to be exposed to things. Um, and kind of being able to, that fine line, because again, some people can be super super clean, so I'm not saying like douse your baby in germs, but just really stepping back and thinking about, it doesn't need to be a sterile environment, and super clean all the time isn't always the best thing for the
Mm.
microbiome. And then, yes, working with someone closely about actually introducing those allergens. So, peanut is the number one
Mhm.
most popular one. And so there's a lot of research around peanuts, eggs being the second one. But yeah, research shows that introducing early and then consistently up into the
Wow.
first 2 years of life. So it's not like a one and done. So you want to keep doing that. And so those are the things that we work closely with the families on, exactly what that looks like, how much, how often, for how long, signs and symptoms, things to look for that could be an allergy, because there's a variety of signs and symptoms. We talk about, probably not best to be doing these things on a busy day or outside of the home, being prepared so that way if there is an allergy, that you're in the best situation possible. But really, focusing to answer all the questions and doing all those steps to help protect baby for the long run.
Wow. I had never considered the skin microbiome.
Hmm.
I like that one is just throwing me off and I it shouldn't throw me off because I know people have contact allergies, right?
Hmm.
Like I understand that, but wow, I had never thought about that.
Hmm. And because there's a typical progression. So a lot of times, if there are people, if they start off with eczema, then you're more likely to go into having a food allergy, more likely to go on to having asthma. So there is, kind of a trickle down. So that's why, if earlier is better, and comes back to that skin microbiome. So the gut will show signs through the skin. And that's kind of
Interesting.
the connection that you're probably not as familiar with. But yes, our
Yeah.
gut will show signs that maybe something is off through the skin. And so, yeah, the first sign is if, babies who have eczema, not all will go on to have food allergies, but they're at increased risk of developing a food allergy. And so, um,
Okay.
it's all connected. Yes.
So it makes me think like which came first, the chicken or the egg? Is the eczema comes before the food allergy or the
Hmm.
food allergy creates the eczema, like having that
Eczema comes before
susceptibility?
the food allergy.
Really?
Hmm.
So what is that? Why is it that your skin will show like what's the connection, I guess, between the eczema and the food allergy?
Um, I think it's just the progression of it, that typically that's the first way it's going to come out. And then, like I said, then not all infants will go on to
Mhm.
have
Mhm.
food allergies, but it is at an increased risk. So that's why some clients can come to us. It doesn't have to be right after birth, and we can still work with them. Even if baby already has eczema, all the more reason to work with us on that allergen introduction, to make sure that we're doing it consistently in the right amounts, because your infant's going to be at high risk of developing that. So it's not, again, it doesn't have to be all or nothing. I mean, if you're already starting, um, solids, and babies like a year old, 8 months, a year old, yeah, it's probably outside of the window to make any significant impacts. But definitely still in those first 4 to 6 months, you can still start, um, well, especially at 4 months, but or at 6 months, sorry, at that 6 month mark is whenever we really want to start incorporating the allergens and everything. And so even 6, 7 months, 8 months, it's not like you've completely missed the window. There's still an opportunity to start, but sooner is better as far as closer to that 6 month.
Wow. Wow. So I'm sitting here thinking about my own son's journey with food. I'm grateful he doesn't have allergies,
Mhm.
um, but he had sensitivities to what I ate through my breast milk to him. And is that like a sign that someone could potentially develop allergies, or is that just what is that? I guess is it related?
Um, yes and no.
Okay.
So it doesn't necessarily mean they're going to go on to have a full blown like anaphylactic allergy. That's more of
Mhm.
what I'm talking about. So intolerances, yes, there's
Okay.
those can still definitely be very real, and some of them, infants will outgrow. um, and that's just as their gut microbiome and everything develops, they can, outgrow some of those intolerances. And so, it's kind of like lactose intolerance versus a dairy allergy. So they
Yes.
can be different.
Mhm.
And so, yeah, what we're talking about is more of those specific allergies,
Okay.
more than the intolerances,
Can you guys pick up on intolerances through the AI, like, algorithm or just the allergens?
the allergens.
Okay, that's good to know. I just, like
Hmm.
so for us, it was like, "Okay, we're gonna breastfeed," and then we breastfed, and it was like, "Wow, I don't make enough milk," and then we ended up doing milk sharing before we moved then to like, a formula to help.
Formula. Hmm.
But then when we moved to formula, it was like, how do I make this decision? Like, I know lactose intolerance runs in the family. Like, do we
Hmm.
go with goat milk and like all of those questions that just like flood your brain at that point in time? So if we were pregnant, we could even after being pregnant, we could take this test. We could fill out this 3-minute survey and get
Hmm.
guidance, right?
Hmm.
Around what type of formula we would want to gear towards.
Yes, absolutely. And because every family is very different with what they need. And so that's why our dietitians, their background, most of them have peds background.
Hmm.
And we even have some that are lactation consultants. And so I know we mentioned this on our call before. We want to be able to provide all support for our clients. And so, yes, they may come to us for food allergies, but issues with breastfeeding coming up. You said you didn't make enough milk. So, I mean,
Hmm.
working with us in all areas, we want to be able to support all of that. But yes, talking through formulas, because every family, every situation, every infant is going to be different. And
Yeah.
so, yeah, working through all of that and what's right for your baby and for your family is going to be very different than another family and their baby. And so, yes, that's part of the individualized approach that we take, whether it's breastfeeding, formula feeding, intolerances, working through all of that. working with the pediatricians. We work closely with the pediatricians as well. But yes, being able to answer all those questions, even we've gotten questions about infants, sleep patterns and, all that all that new fun baby stuff that especially for first time parents can get
Mhm.
overwhelming. And so we're just there to be a resource for the whole family in all the areas that they need.
That's so powerful.
Yes.
That's powerful. For me, at least, when we were making that transition to like, okay, what formula are we going to explore to introduce? What feels right for us? I had
Mhm.
restricted things that I ate when I was nursing him or
Mhm.
pumping to give him milk. And because I saw how he interacted with what I ate. And so it
Mhm.
was just so much thought went into it, and I didn't feel like I had somebody to bounce these ideas off of that was
Yep.
educated.
Yes, and I mean, and you're right. Most people don't have contact with a registered dietitian. Most physicians don't have a registered dietitian on staff or in their office, and some I mean, I get my pediatrician's office asks me all the time for, wanting to be able to have referrals and everything, just because that's not their area of expertise,
Yeah,
or, you see so many clients in a day, you want to be able to give that extra support. And so being
yeah.
able to see someone who specializes in that just really takes a lot of that pressure off because, it could be, a few sessions. It could be someone who works with a dietitian, over a year, but every little bit and all that extra information, it just makes a world of difference whenever, especially a new parent, or a young infant in general, whether it's your first,
Mhm,
second, fifth. It can,
mhm.
they're all different, right? So each baby is different and each experience can be different. The first three, everything went textbook just like this, and then this fourth one threw me for a loop.
Yeah.
I hear,
Mhm,
all those stories too.
mhm.
And so just because you've gone through it before, doesn't mean that, they're going to throw a little zinger at you and
Yeah.
and kind of stress you out a little bit. So yeah, they're all different, and that's why we like to work with the families and help them as a whole, for sure.
Yeah. I think it's a unique service that you offer, not just in the essence of preventing and like providing individualized treatment plans, right, for
Hmm.
each
Yep.
family that comes forward, but also being able to have that holistic like approach. We see you as a whole family. We're supporting you emotionally as you're going through
Hmm.
this. Like we're here to
Hmm.
help you as you're making decisions and trying to weigh pros and cons and safely, implement any interaction with the
Hmm.
allergen, like, that's a beautiful network. So tell us, like, what does this look like if someone were to receive your services? Is it on the computer? How often do they have access to the dietitian that they're working with? What is that like?
So for our food allergy prevention program, ideally, right after birth, we would, I say ideally, it depends on how you view things. So I say ideally because the accuracy of the AI is going to be at the highest, 80% accuracy after the baby's born because of those two things that we
Mhm,
talked about. Um, but again, it can also be very overwhelming to meet with a dietitian with a newborn, especially with the
mhm,
information that we're going over. So
mhm,
it is also common to meet with us in the first visit during pregnancy. If you come back high risk during pregnancy, then we can go ahead and meet at that time because I personally believe it's a little easier to retain that information and hear it more times
yeah,
than
mhm,
receive everything once right after baby's born. Now it can be done obviously, and everyone's a little bit different, but it can get a little overwhelming because we go over a lot of information. Typically, for us, it's 6 sessions over the course of the first year of life. And so, depending on where you are in when you come to us, will kind of determine what that looks like over that course of the first year. So, the most important is, at the 6 month mark, we meet about the allergen introduction, and then 2 weeks later, um, to go over exactly what that's looking like for the family and how it's going. But
mhm,
up to that point, pregnancy right after birth is typically whenever we'll see people. Again, in that 2 to 3 month time, well, 2 month, 4 month, 6 months, 2 weeks later, and then 2 months after that. but everyone's a little bit different. That's just typically our we have 6 sessions. It can go up to 8 sessions, just depending whenever you get into that toddler phase. Again, you might hit another picky eating or baby led weaning kind of discussions with the
Mhm.
dietitians of, again, what's going to be right for your family. And so that could kind of initiate a few more sessions at that point in time as well. So, like, because we like to incorporate and answer all the things around eating, and so it doesn't have to strictly be just, the food allergy
Yeah.
prevention. But yes, we just want to check in, like the 8, 9 months to make sure everything's good. And then again around that year, because that's whenever you might see some of the picky eating, and things pick up at that point that we could also address.
Yeah. And I heard you say that the AI algorithm can predict most accurately if it knows if you had a vaginal birth or delivered on time or
Hmm.
C-section, right? And
Hmm.
then it's an 80% accuracy at that point in time.
Yes,
Okay. And
which
then
is amazing in the world of science.
it is amazing because it's
That's
preventative. Like,
yes.
we're shifting the narrative here. We're not
Hmm.
reacting to an allergen, we're preventing.
Hmm.
Um, and I'm also curious, what is the efficacy of these tailored, individualized interventions? Like, once we have the information and we begin working with you because we know, okay,
Hmm.
there's a high risk here. What is the effectiveness of that intervention? Do you have like efficacy rates?
Um, I think I'm pretty sure. I don't want to misquote because I don't. You kind of put me on the spot a little bit. Um, I think it's in the 80 to 90%. It's
Okay.
high. It's high.
Wow.
Yeah. Of the introduction of allergens early.
Wow.
Yes.
Okay. So there's like majority percent chance that when you learn about the risk and you begin working with this program with MyOr, that you'll be able to prevent ongoing allergies throughout life for the things that were detected.
Hmm.
And does this
Yes.
algorithm detect specific allergies?
Right now, it does not,
Okay.
but it can, and that's the next thing that they're working on.
Yeah.
But we just talk about introducing any and all of the allergens, and we talk about what those top allergens, what they are. That's part of the education. So a
Yeah.
lot of the research is done in peanuts and eggs,
Mhm.
and so we talk about the major food allergens and what that looks like, and recipes and ways to introduce those as well. So we
Yeah.
do it across the board.
Yeah. So I
Yeah.
imagine like tree nuts are usually, I know a million people with tree nut allergies, right?
Hmm.
So
Hmm.
that's probably one of them. What are some more? There's peanuts, tree nuts, eggs.
Sesame, yeah, eggs,
Oh, sesame.
dairy, wheat, hmm,
Mm,
shellfish.
Oh yeah,
Yeah,
shellfish is a big one.
those are big
Yeah.
ones. That's mine.
Is it? Oh,
Yeah.
yeah.
Yes.
Wow. Okay. So it'll just tell you if you have high risk for the major known
Yes.
allergens.
Yes. Yeah.
Okay.
And then we do the introduction. Like I said, the main, like the peanut and egg first, but then we educate on all of them,
Mhm. Yeah.
and soy, and yeah, all of them. Hmm.
Yeah. So when you're working with the client and the pediatricians all together, like a team approach, what does that look like for like preventative cautions? So you spoke like you know this, I know this as a mom. Like anxiety runs high when risk is involved, right? And so
Yes.
when there's risk and there's anxiety, this is my wheelhouse as a therapist,
Yes.
right?
That's why I
There's
reached out to you.
yeah, I know. There's
Yeah.
so much that comes into play. So what are some of the things that you guys discuss to create safety plans like to support the mitigation of risk and help guide confidence in the parents in following what you're recommending.
And I think a lot of that comes with the time and the education piece of it, which is why my work came to be with dietitians, because we
Yeah.
take the time, we're sitting down, we're having 60 to 90-minute consultations to
Wow.
really to take time to educate, answer questions,
Mhm.
and then provide, the literature. And so that has proven, that's why,
Yeah.
why it the effectiveness, right? So if people know and understand the why behind things, that's going to make them more likely to stick with the protocols and the regimen. And so really breaking it down, why, like where the risk factors are,
Mhm.
and giving those doable actions gives people the power, right? To help, like we all we're doers. Sitting back
Mhm.
and feeling we don't have control over something is what
Mhm.
is what makes us anxious and worried.
Mhm.
And so we give them doable actions and put the control back in their hands. And if sometimes that can feel too much, right? And that's
Mhm.
where I ask for some referrals, such as
Mhm.
yourself, so that if we see that and we feel that, it feels like it's too much, that we can be able to, make some referrals, for that support that they need that's beyond a dietitian. But I think, knowledge is power, and that's
Yeah.
really what we take the time to do, is really going over what the plan is, answering questions up front, being available to answer those questions and give that support, signs and symptoms to look for, and, a handout that has recipes. Those are all doable things that are,
Mhm.
action driven, that they have
Mhm.
control over. And so I
Mhm.
really think that that is the key. And then explaining why it's important to continue, like I was
Mhm.
saying, you want to continue that exposure for the first 2 years of life. And so knowing all of that, I think really helps increase compliance.
Wow. I think it's such a blessing what you guys have figured out, what MyOr has figured out that they can do. Like the fact that you can even begin to say, like with 80% accuracy, that
Yeah.
someone will have this risk for these allergens that can be life threatening, right? Anaphylactic
Hmm.
shock is real. Like this is life-threatening, and I know, like,
Hmm.
my neighbor across the street has 2 kids where she carries EpiPens everywhere they go,
Yep.
and she is in constant fear that
Hmm.
even through touching, like, an allergen, that her children will die, and so
Yes.
it's like, to think that there's something that can predict and help prevent it getting that far is
Yes. I
amazing.
mean,
Motherhood is a beautiful journey, but it can also be overwhelming. Do you often find yourself feeling isolated, struggling to find balance, and yearning for a sense of identity beyond mom? Trust me, you're not alone. Join the Empowered Mamas Club, where you'll discover a supportive community of like minded mothers. Gain valuable skills to navigate those highs and lows of motherhood, reclaim your sense of self, and become the engaged and present mom that you desire so that you can create cherished moments with your little ones. It's time to prioritize your well being and rediscover the joy in motherhood. Click the link in the show notes and join us in the Empowered Mamas Club today.
I mean, it is amazing. And yeah, and being someone who has a food allergy, like I said, I have the EpiPens.
Mhm,
I've worked in hospitals. I've had to go to the ER because I was cross
mhm,
contamination,
mhm,
and it's scary. And yes, as an adult and as a parent, caring for a child, especially if they're
mhm,
not able to verbalize, depending on
mhm,
their age,
mhm,
it's a lot to own. And
mhm,
there's a lot of fear around, other providers, and them owning having to educate the other providers and making sure
mhm,
whoever's watching them or helping,
mhm,
everyone knows how to use the EpiPen. Everyone,
mhm.
knows
Oh
about
my
cross
gosh, yes.
contamination, and
Mhm,
it is a lot. And
mhm,
so yes, the fact that, um, we there's something that we can do, and I'm gonna say the words as simple as, not exposing the skin to the allergens and orally,
mm.
ingesting the allergens. It seems too good to be true. But it really has come to that. And I think it's just that we're just finally at the point where enough research has been done
Yeah,
to validate that.
yeah.
So, because, whenever I was having kids, they told me to rub peanut butter on their leg and see if they have a reaction. And now that is the complete opposite of what we want you to do. And
I've
so
never heard of that, thankfully. That has not come to my world.
yes, it's crazy. So that's like the worst thing that you could possibly do. And luckily, my son did not end up with a peanut allergy. But um, yeah, it seems simple, but it's like, even if you're low risk, for me as somebody with a food allergy, if I took this, 12 years ago, and my kids came back low risk, which they probably would come back high risk. But even if they didn't, what's the harm? Like, why not do it? If I
Yeah.
knew that I could prevent something, even if there was a low risk, why not prevent something
Yeah.
if you have the tools at your fingertips in your home? It's, there's nothing special you have to go out and buy or do for this. It's just being educated on how to do it. And so that's,
Yeah.
for me, it's like a no-brainer. Like, why not? It's just that people don't know.
Yes. And that
That's
makes me wonder, what is so I always think, is there a barrier to access, right? Like financially, how much does it cost to take this test? And what services are available if people don't have the finances available to like shell out for these 6 sessions? What does that look like? What does the access look like?
So, for us specifically, so I mean, we take major insurances. So,
Okay.
luckily, in the last 2 years, insurance has really started covering a lot more nutrition
Wow.
services. And that's been recent, and so that's good timing with MyOr. But yes, so dietitians are becoming more accessible, um, and more dietitians are getting, trained and familiar with food allergies and everything. So
Mhm.
there are a lot of options out there. There's education out there. There's resources for food allergies and educating on a lot of the same topics that I've had that are free.
Mhm.
But again, it's that working with somebody and having that
Yes.
support. So
Mhm.
for us, yes, and especially under prevention and with children, insurance tends to cover really, really well for those visits. Most families don't have to pay anything out of pocket
Wow.
um, for the insurances that we take right now, and we're
Wow.
growing and trying to take more insurance. But that is one huge plus that's come in the last 2 years. Because before, I mean, dietitians, it was such a pain even dealing with insurance that everyone just wanted to do cash,
Oh
and
yeah.
yeah, that can get expensive
Yeah.
for sure.
Mhm. I know that
Yeah.
song and dance very well.
Yes.
So, if their insurance isn't accepted, what is the cost of working with you guys?
For us, for the initial, consultation for that 90-minute, it's a $200, and then
Okay.
for each follow-up, it's $150.
Which is not bad when you think of if your child does have an allergic
Mhm,
reaction and you start
mhm,
down that path. I
mhm.
know like our friends and family have spent tons of money
Oh,
reactively.
tens of thousands. Yes,
Yes.
yes. When you look at it, yes, of what you could spend upfront for 6 sessions,
Mhm.
versus managing any disease. To manage any disease is gonna be way more expensive than to prevent them in the first
Yeah.
place. Yeah,
Yeah. And even just the
definitely.
cost of an EpiPen, like I don't know why, like my mom needs an EpiPen and it's not covered under her insurance and she has to pay for it. And I'm like, I don't understand that. Like, you need
I
it. Like, I don't understand
I
that.
What's so sad is I can't tell you how many years I went without one, because, yeah, they were so expensive,
Yes.
and, I thought I knew everything, or I would know it if I was exposed. But honestly, the more you're exposed to it, the worse your reaction gets. And so,
Wow.
I hadn't been exposed in 12 or 13 years, and I was this past January, and I was in a hospital, I was working in a hospital, and I walked to the emergency room, and within 7 minutes, I thought I was gonna pass out. 7 minutes from the time that I ate to the time that I felt like I was in imminent danger. I could tell us, like, I knew something very bad was happening, and I knew I was having the reaction, but that's 7 minutes isn't very long. And I
Mhm.
wonder, and I think, I'm like, if I was at home, I don't know if I wouldn't have been able to drive. Hopefully, I would have had to call an ambulance if I was home by myself, and I don't think anyone could have driven me to an emergency room fast enough. If and I mean, I have my EpiPens too now, but, like, if you don't have an EpiPen,
Mhm.
it's a race against time. And so,
Mhm.
yeah, it's very scary. And that's me as an adult and I know a lot about food allergies, and I know the signs and symptoms, and I know myself really well. And I did not think that there was a cross contamination that occurred, but clearly there was. And so
Yeah.
it can happen that fast. And so that's why with these little ones, and they can't necessarily articulate it, um, but it's definitely a lot, and it can be very scary for the parents.
Yeah. I think of what that last thing you just said because they can't articulate it.
Mhm.
Like,
And that's
you
why
just
we
have
own
to
so much
catch
of it
it.
as parents. We have to
Yeah.
know all the things to look for, and be so in tune with our kids, and that's why it's
Right.
hard to, let them go to daycare or leave them with babysitters, or,
Mhm.
because they don't know our kids like we know our kids, and
Yeah.
so, that can be hard, very hard.
Mhm.
It's a
Mhm.
lot that we
Yeah,
carry around with us as parents.
it is. It
Yeah.
really is. And to take the test, the 3-minute, like, questions that people are
Mhm.
filling out, does that cost anything?
Nope, free of charge. It's free
What?
of charge.
And to
Yeah.
get your results, it's free of charge?
So the results, we do want you to meet with us so that we
Mhm.
can explain everything.
Mhm.
So you won't be given your results. A dietitian has to go over the results with you, and that's for a couple of reasons, but mostly because it comes back to the education
Yeah.
factor. And
Will it say if will it tell you if you need to meet with a dietitian or not? Like, if there's no risk, will you still need to meet with a dietitian to learn there's no risk?
Um, the dietitian will reach out and tell you that for the first whenever, so they'll tell you verbally if it's
Mhm.
high or low risk, and then you don't have to it's not part of the consultation. No, it's
Okay.
up front. You don't have to like have the 90-minute consultation to find out. You During the 90-minute consultation, you'll go through the report and find out what areas
Okay.
determined high or low risk. But no, they will. It's just that a dietitian has to verbally give you the results
Okay.
instead of like on your phone, it popping up what the results are.
So
But no, they
someone
can
gives you
tell
a
you.
call.
Yes, they give you a call and they
Okay.
tell you if you came back high or low risk, and then explain the benefits of meeting with them, and see if you'd like to schedule
Mm.
with them to learn more.
So there's no cost to assess, and as soon as you find out that, like, "Oop, there is a risk," your insurance might cover it, and if your insurance doesn't,
Mhm.
even the cost of what you described is not a lot compared to what you end up paying in the long haul.
Yes,
So, like,
yes,
this is like a
absolutely.
win-win. It just everything feels too good to be true, what you're
I,
saying,
I
like,
agree. I agree. Yes, it is.
oh,
It
wow.
definitely
Okay.
is.
So my next thought really is, like, how do people find you? But before we go there, is there anything I haven't asked that you feel like parents need to hear in this conversation?
I mean, I feel like we've gone over a lot of it. I know. So MyOr, they're working on other technologies to predict in other diseases as well. So this is definitely a company I'm super excited to be a part of and grow with, and they really support dietitians, um, which is usually not the case out there. And so they, really valuing the dietitians and the work that we do, and our passion for prevention, and our passion for educating clients, and working with them very closely. It's just it almost feels too good to be true, but it really is a company that cares about people, cares about you know taking care of people, and putting that control back into your hands, and giving you that information. And so that's really, I can't say enough great things. We're just very small, very tiny, and hopefully, we can grow and get the word out, and people can really learn, how great this program is.
Yeah, and what areas do you guys serve?
So we have dietitians licensed in I just looked yesterday, all but 7 states. So
Okay.
there's still 7 states that we're trying to get our dietitians to get licensed in. And so you can be licensed in multiple states. So that's what we're working on right now. So our goal, by next month, is to have all 50 states covered.
By next month. Go
Yes,
you.
I
Wow.
know. We just did another round of recruitment, and we're bringing on 11 more dietitians to our
Oh,
team.
that's
So,
amazing.
yeah,
That's
very
amazing.
exciting.
I think something that really sticks with me right now is, like, you're describing how much MyOr cares about the work that it's doing,
Mhm.
and it's so rare to spend 60 minutes or 90 minutes with a professional educating you, talking you through things, especially when you're used to, like, going to the pediatrician and it's less than 10 minutes. Like, you
Yeah,
wait
that
in the
you're
lobby and then you wait
yep.
in the room forever and then they pop in for a hot second and they're gone, and you're like, Okay.
Yeah.
And to know 60 to 90 minutes to truly be heard and educated and feel competent enough to walk away with a plan and a next step, that shows how much this organization truly does care to be able to structure that time in.
Exactly. That is the main difference. And yeah, it's just the workflow is different with pediatricians, not knocking on any pediatricians. It's just they couldn't possibly sit down
No.
for even, 45 minutes, 30, 45
Mhm.
minutes.
Mhm.
I know there are times where I'm sure that happens, but that can't, be a regular occurrence
Mhm.
for most pediatricians. And
Mhm.
so it's just something, not something that they have access to. Um, and then again, when anything that comes to diet nutrition, you know, the pediatricians like to be able to hand that off to dietitians,
Yes.
just because that's, their area of expertise.
Yes.
And that's,
Mhm.
it's refer out just like you would for, ENT or, anything
Mhm.
like that. So get
Mhm.
them to where they can, have the most expertise from that
Yes.
area. So
Oh, I love that. I love that so
definitely.
much. Okay, so tell us, how do people find the website, take this AI quiz to learn their risk? Like, how do we find you guys?
So it's myorcare.com,
Okay.
MYOR care.com. And whenever you get it, it says take the survey, and it will just prompt you through all the questions. I'll start with asking if you're pregnant or not. They'll collect information like your name, what state you live in, um, some general background questions, and then it'll dive into all the questions about your baby and you and your family, and determine if you're at high risk or not.
That's amazing. Every family who is pregnant or has an infant should be doing this.
Yes, I know. That's why I wish I could shout it
Oh,
from the rooftops for more people to hear
yes.
about us, because
Yes.
it's yeah, it really is just that simple and that straightforward. So we're
Yes.
still relatively small team. Like I said, there's like 30 of us as far
Mhm.
as the dietitians, but a lot of them have multiple state coverage. So yeah, we're hoping next month to be able to provide any medical nutrition therapy across all 50 states.
I love that so much. I think what you guys are doing is absolutely amazing. I think that breaking into the health market and the health world in a preventative level is really hard to do.
I
And because preventative is the moneymaker, so people don't spend a lot of time there. They don't invest a
you
lot in
got
it.
that right.
So I see you guys standing strong and doing the hard work and making the choices to spend the time with the families and bring this invaluable resource forward, even in the face of, I can only guess, the amount of difficulties it has been to get to the point you're at right now, being a preventative
Yes.
service. So,
Yes. Well, I
that's
appreciate
amazing.
it. Thank you so much.
Yes,
Thank you for
thank
letting me come on
you.
here and talk about who we are and where we came from, and what our vision is, because that really is, we just want to help people and be able to put the control back into their hands.
Yes. Well, thank you so much. I will put in the show notes of this podcast episode the website link so that people can go
Awesome.
and take the survey and start working with you. So thank you,
I
Jana.
I love it. Thank you so much.
Mhm. It has been an honor to share this space with you today on the Empower to Heal podcast, where we illuminate the strength you have within yourself to heal. Make sure you subscribe so you don't miss our upcoming episodes, and leave us a review on your favorite podcast platform.